Good morning. Welcome to Asthma Grand Rounds and welcome to our new 2011-2012 program series. Welcome to our video conferencing colleagues at Mass General and North Shore and Leahy Clinic. Thank you for joining us. Today we have a clinical program, a panel discussion that addresses the therapy of moderate asthma. As you know, the National Asthma Education and Prevention Program, through their expert panel, releases guidelines for the management of asthma. The last set of guidelines was the Expert Panel 3 in 2007. And a lot of information has emerged since then, some of it generated by researchers at Partners Asthma Center, and gives us pause and a chance to think about what recommendations of the next expert panel 4, might include as they think about treatment of moderate asthma. And to begin our discussion, I've prepared a brief case history of such a patient that has been shared with our panelists. And let me actually begin by introducing our panelists. That would be most appropriate. Dr. Anna Feldweg is an allergist here at Brigham and Women's Hospital and an associate editor of allergy at Up to Date. Dr. Elliot Israel is allergist and pulmonologist here in the pulmonary division at Brigham and Women's Hospital, where he heads the Asthma Research Center. And Dr. Aidan Long is allergist at the Mass General Hospital, where he is clinical director and director of the fellowship training program. An all-star panel, the people that you would like to ask if you needed advice about designing another set of guidelines. So here's our case history that we're going to ask our panelists, how would they approach the treatment? We're going to ask each one in turn to just do a brief presentation, and then we'll have time for a panel discussion towards the end. A 23-year-old woman seeks your help for management of her asthma. She has had asthma since early childhood. Triggers to her symptoms include cats and dogs, change in the seasons, particularly summer to fall right around now, and strong fumes or odors. She had one emergency department visit for an asthma attack about 3 years ago. That was in the context of a respiratory tract infection, but has otherwise had no episodes, severe episodes that required oral corticosteroids. Since high school now, she has been taking fluticasone meter dose inhaler, 44 micrograms per puff, and she takes 2 puffs twice daily, and albuterol by meter dose inhaler as needed. Now, over the last several months, she has found that she needs her albuterol inhaler more often than previously, and typically now it's as often as once or twice a day for tightness and cough and a sense of shortness of breath. And she finds that she awakens from her sleep once or twice a week with this cough and tightness, and it's relieved promptly by use of her albuterol inhaler. She went and purchased new allergy-proof covers for her mattress and pillow, but no change in her symptoms. She lives in what she thinks is a clean second-floor apartment. There's no carpeting, no pets. She works in a retail store and which does not seem to bother her breathing. She reports that she is very good about taking her medicine. She's very compliant morning and evening, and there in the office she can demonstrate for you good inhalational techniques. She uses her inhaler properly. She has no other medical problems. On examination that day in the office, she looks very fit and her chest was clear. And her peak flow is 320 liters per minute, which is 80% of the predicted for a woman her age and height. And we're wondering what next for this woman who I think we would agree does not have well-controlled asthma. And I will remind you what 4 years ago the expert panel suggested in their step care approach to the management of asthma in someone already taking inhaled corticosteroids in low doses. Here's the step 3 recommendation for 2007 that includes low-dose inhaled steroids with a long-acting beta agonist, or increasing to medium-dose inhaled steroids, and less favored, but alternative would be low-dose inhaled steroid with a leukotriene modifier. And in tribute to the old people on the panel, theophylline. So with that background, I'd like to introduce Dr. Elliot Israel as the first speaker to give his thoughts about how he would approach this patient. Dr. Israel.